Falls are commonly reported by patients with Parkinson's disease, especially in the advanced stages of disease. About two-thirds of individuals with Parkinson's disease may encounter falls. Impaired balance, stooped posture, freezing, poor vision, and symptoms such as slowness and delayed reaction time may make one vulnerable to falls. Another cause of falls may be medication used for other medical conditions such as antidepressants, sleeping medication, and drugs used for high blood pressure. Physical injuries such as bruises, fractures, and concussions may result from falls. These injuries not only interfere with the management of Parkinson's disease but also result in decreased independence, which leads to loss of confidence and depression. In order to prevent falls, it is important to make sure that your home is safe. Your residence should have enough light to allow you easily navigate at night time. You may also want to install night lights that can guide you to the bathroom if you need to get up at night time. If you have any loose rugs, they should be removed and replaced with wall-to-wall carpet so that your floor is not uneven. The carpet helps by acting as a cushion if a fall does occur. If you have bare floors, you should not wax them. Also, if there are any loose rugs or objects on the floor, they may cause a trip over. Pets such as cats and dogs may lie on the floor, causing a trip over. If you live in a house, make sure your walkway and steps are in good condition. The furniture inside your house should be strong enough to support your weight, so it can help you in case you lose your balance. Additionally, you should avoid any furniture with glass top as they may become a hazard. Furniture should not be moved frequently. In this way, you will be familiar with your surroundings and you will be able to find support in case of an emergency. You should consider installing handrails in your hallway and bathroom. Handrails are also useful on both sides of staircase. You may also want to mark the beginning and end of stairs with a pin. In home with multiple levels, you should have a phone on each level. Wireless phones may be helpful for you. You should not lock the door of bathroom from inside. Non-slip bathtubs, bath benches, showering, dressing and undressing while sitting, non-skid adhesive strips are also effective and can be placed inside a tub or a shower stall. In addition, a home safety assessment by an occupational therapist can give you further advice on how to make your home safer. By having a good balance, you can prevent falls. You should make sure that your shoes are in good shape and comfortable. They should give you good support and fit well. You should avoid high heels. When walking, you should try not to multitask. If you have Parkinson's disease, your automatic reflexes are decreased. In this way, you are at a risk of losing your balance if you try to accomplish multiple tasks at one time. You should keep your one hand free at all times. This will allow you quickly find a spot. Additionally, you should avoid carrying items in both of your hands, and if you are standing still, you should try to keep your feet at a shoulder length apart. When your feet are closer together, you are susceptible to loss of balance and falling. You should keep your outdoor steps clean and free of ice. You should keep a phone or an alarm on the floor and wear an alarm bracelet with 911. This will make it easier for you to get help if a fall does occur. If the help is within the hearing range, you should consider wearing a whistle. Also, you can have someone check up on you once a day and see if you need any help. If you happen to have a fall and you are alone, you should try to lie down on your back, swing yourself onto your side, use your hands and get into a sitting position, slowly crawl towards the nearest object that can support your weight, put your hands on the seat of the furniture or chair and space them apart, bring your best leg up so that your knee is closer to your chest, Push up with your feet as well as your hands to get into a standing position. This information is provided only for educational purposes and should not be taken as a substitute for the medical care and advice of your physician.